Mental disease, homeopathic concept. So regarding mental disease, Dr. Samuel Hahnemann has mentioned about mental disease in Organon of Medicine. Mental disease is mentioned from aphorism 210 to aphorism 213. In aphorism 210 of Organon of Medicine, Dr. Samuel Hahnemann says that mental disease is a type of one-sided disease and that is of psoric origin. Psoric origin means that is, according to Samuel Hahnemann, the fundamental cause of chronic disease is due to three tendencies or three miasms, of which the first miasm or the mother of all the other chronic disease or the mother of the all other chronic miasm is the psoric miasm, or it is in scientific term we can say that it is an inflammatory miasm or inflammatory defense mechanism of the organism. So this fundamental or mother of the all the other chronic disease, Sora, is the origin of mental disease and that is a one-sided disease. According to Hahnemann, one-sided disease means the other morbid symptoms disappear and a single prominent symptom exists. So all the other symptoms of the whole body will be ameliorated or disappear and only one prominent symptom, a single prominent symptom exists. If such a condition occur, then it is called one-sided disease according to Samuel Hahnemann. And if this a single prominent symptom is mental symptom, then we call it as mental disease. So all the other physical symptoms and all the other morbid symptom of the organism gets disappeared and the mental symptom is very prominent, then we call it as mental disease. So, according to Samuel Hahnemann, mental disease is not a separate class of disease. We don't consider mental disease as a very different type of disease from other than physical disease. Like diabetic mellitus, like hypertension, like psoriasis, like any other disease. Mental disease is also a class of one of the class of many disease, and that cannot be considered as very much dangerous, or a mental patient cannot be considered as a very morbid disease, a person suffering from more morbid disease than every other patient. So mental disease is also a type of disease like physical disease only, and that is not a very different entire separate class of disease. So in aphorism 211, Samuel Hahnemann says that accurately observing physician should perceive the state of disposition of a patient, and the state of disposition of the patient is considered as characteristic symptom in the case of mental disease. So physician should first give importance to the disposition of the patient and the case of mental disease. In aphorism 212, Hahnemann says about drug proving. Hahnemann says that every medicine or every drug that produce an alternation in mind and disposition during drug proving. So during drug proving, every medicines produce some alternation in the mental level, as also in the physical level, and each drug do so in a different manner. So different drug have different type of mental disease, mental symptoms produced in the healthy human being. So if we give one medicine, that will produce a different type of mental symptoms, entirely different from all the other drugs. So that is how individualization occurs with the specific medicines. In aphorism 213, Samuel Hahnemann says that selected medicines must produce similar alternation in mind and disposition, else no cure. So, during mental treatment of mental disease, the medicine that you select should also be similar, or that should also cover the mental symptom of the patient. If that does not cover the mental state of the patient, then there will not be any cure. For example, if you consider medicines like aconite is a medicine that will produce intense anxiety and very fear of death. If the patient is not having this important symptom of anxiety and fear of death, then that will not cause any change in the mental sphere of the patient. Like that, Nux vomica is a drug that is having intense anger and he is very excitable from slightest external impulse. And if the patient having a very calm nature or calm disposition will not be cured by the medicine Nux vomica. And at the same time, the drug that just opposite to Nux vomica is Pulsatilla. Pulsatilla patient is very calm, and a person who is very angry, he cannot be given Pulsatilla. So the medicine selected in the case of mental disease should surely be similar with the mental state of the patient. This is what Hahnemann says in aphorism 213. In aphorism 214, Hahnemann says about cure of mental disease. Hahnemann says that like as other disease, all other physical disease, the medicine must produce similar symptoms both in mind and body as that of natural disease. As in any other case, we will analyze the mental generals and physical generals and particular generals of the patient. Like any other physical disease or any other natural disease, in the cure of mental disease also, a physician must elicit about the mental symptoms and physical symptoms of the patient. This is what Hahnemann says in aphorism 214. In aphorism 215, Hahnemann says authentic definition of mental disease. Hahnemann says that the mental symptoms become very much increased and the corporeal or the physical symptoms become decreased. And like that, at last it will reach a state like a one-sided manner, like the whole system of the symptoms will be localized entirely to a to the mind and disposition of the patient. So the local disease only confined to the mind and disposition of the patient. So this is what Hahnemann mean by mental disease. In aphorism 216 onwards, Hahnemann says about the classification of mental disease. The first classification of mental disease according to homeopathy is there is somato-psychic disorder. So first that means the physical symptoms that gets converted or transformed to mental symptom. That is previously slight mental symptoms that become rapidly increased and the previously very much corporeal symptoms that was that was in a dangerous condition lost all its danger and then gets converted to dangerous mental symptom. So the mental symptoms rapidly increases and the corporeal symptoms lost all its danger. And that effect in that and affection in the corporeal or physical system that gets transferred to mind problem in the mind and in emotion. So this is called somato-psychic disorder. That is physical symptom gets converted into mental symptom. For example, a patient suffering from suppression of lung, that all its symptoms get the suppression of the lung, the dangerous symptoms gets ameliorated and that gets converted into insanity, mania, melancholy symptoms. So here we can see that physical symptoms lose all its danger and the mental symptoms gets aggravated. In aphorism 217, Hahnemann says about totality construction in somato-psychic mental disease. So here in the totality construction, we have to consider both the physical symptom and mental symptom. In aphorism 218, Hahnemann says about what is mean by corporeal symptom, that is previous corporeal symptom. That is corporeal symptom before going to a one-sided manner. And before going to one-sided manner means before the onset of the severe mental symptom all the symptoms that was existing, all the physical symptoms that was existing before the mania or the start of mental disease. So these previous corporeal symptoms can be collected from the patient's friends, or that can be collected from previous medical records. In aphorism 219, Hahnemann says about present corporeal symptom. So, between two mental maniac episodes, there is a lucid interval or an interval between two episodes of mental disease. There is a mental symptom free interval in which the corporeal symptoms or the physical symptoms become aggravated. So the corporeal symptoms appear and there is a transient elevation of mental symptoms during lucid interval. These corporeal symptoms should be compared with the previous corporeal symptoms, and that constitute the logical totality of corporeal symptoms. In aphorism 220, Samuel Hahnemann says that corporeal symptoms along with the mind and disposition of the patient should be considered in the totality construction of a mental disease, and the mind and the disposition of the patient can be known from the patient's friends, and the physician himself observe the symptoms. The keen observation of the physician can also elicit the mind and disposition of the patient. And Hahnemann says about treatment of somato-psychic disorder, and he says that if the mental disease lasts some time, then we have to consider anti-psoric medicine, that is a deep-acting medicine covering strikingly similar symptoms, especially of mind. So we have to consider the totality of the symptoms covering especially the mental symptom of the patient, and should give a long-standing or deep-acting anti-psoric treatment, and through a long-standing anti-psoric treatment we can tackle this disease. In aphorism 221, the second classification of mental disease according to Samuel Hahnemann, there is mental disease due to exciting cause, like fright, vexation, or spirituous liquors. So mental disease that suddenly become aggravated due to an exciting cause. A patient gets maniacal or melancholic uh, condition after grief, or after sudden exciting news, or vexation, or after fright. Mental disease started. If due to exciting cause, there is one of the classification of mental disease, and here the mental disease occurred due to transient explosion of the latent sora. So the sora become latent in the patient's ordinary calm state. The sora, I have already said, sora is the mother of all the chronic disease according to homeopathic philosophy, and this sora is latent in the every humankind. And then with the attack of the exciting cause, the latent sora gets transformed into a transient explosion of latent sora, that is converted into acute disease. So depending upon the various constitution and individual disposition idiosyncrasies of various individual, the transient explosion of the latent sora due to exciting causes manifested as different kinds of acute diseases. In some patient who is indisposed to mental disease, this exciting cause can be converted to a mental disease having predominant symptoms of mind. So that is how exciting causes cause mental disease, like that. And here the treatment is not antipsychotic treatment. In this condition, mental disease due to exciting cause, we have to consider other class of true medicine. Or in other words, we have to consider medicines which have specific action on on insanity, or specific action for mental disease, like aconite, belladonna, stramonium, hyoscyamus, and mercury. So we have to consider the acute totality of the symptoms, and we have to consider superficial medicine having specific action for mental disease. So we have to differentiate the characteristic symptom of each disease, each characteristic symptom of each individual, and should tally with the characteristic symptom of the specific medicines, with a specific group of medicines, superficially acting medicines, and should be given according to individualization. So, first, in this condition, due to mental disease, due to exciting cause, we have considered non-antipsychotic medicine, and the administration of non-antipsychotic medicine can revert the condition to a former latent state or latent sora, which are comparatively calm state, with subsiding the acute totality. And in aphorism 222, Hahnemann says that in the case of acute mental disease that occurs due to an exciting cause, after administration of a non-antipsychotic medicine, when the condition reverts back to a latent sora or a latent state, you should not be considered this state as a completely cured state, as it is quite ready to break out anew, and do not regard it as a completely cure, and should be and must be followed up with a deep acting antipsychotic medicine along with a strict diet and regimen as as detailed in the Organon of Medicine. In aphorism 223, Hahnemann says that if this antipsychotic medicine treatment is omitted, if this deep-acting medicine is not given as a follow-up remedy, then severe attack from slighter cause than before will occur, and the sora in such condition the sora will develop completely, and what that result is that the result in more lasting severe attack that leads to a periodic mental disease or a continued type of mental disease, and this state is more difficult to cure with antipsychotic medicine. If such a stage is reached, then it's very difficult to treat even with antipsychotic medicine. So you must remember that after converting, after giving other class of true medicine, if when the acute symptoms subside, then we have to consider deep acting medicine and should be followed up with episodic medicine. If this is omitted, this is omitted, then it is very difficult to cure the condition. Next is aphorism 224, that is mental disease of doubtful origin. This is the third classification of mental disease according to homeopathic concept. Mental disease of doubtful origin means we don't know, we are doubtful about from where this mental disease gets originated. Maybe the mental disease gets originated from purely a psychological origin, or it may be having a purely corporeal or a physical origin. So to differentiate this, what we have to do is we consolate the patient. If the mental disease due to psychological origin, that means mental disease is due to fault education, bad practice, corrupt moral, neglect of mind, or any superstition or ignorance. All these are mental disease due to psychology, purely psychological origin. In such condition, if we consolate, then if the consolation got amelioration, then that means it was mental disease purely due to psychological origin. At the same time, if we do consolation and that gets aggravated, then that means that was a mental disease from a corporeal origin. So, what happens in where if we consolate a mental disease of corporeal origin is A melancholic patient that become more dejected. A maniac patient become more exasperated. A chattering fool become more foolish by consideration. So this is how we differentiate a mental disease from psychological origin and a mental disease from corporeal origin. So, the consolation that Hahnemann says is that sensible, friendly exhortation, serious representation, and consolatory arguments, and sensible advice. If all these things ameliorate the condition, then means the mental disease is of a purely psychological origin. And if that cause aggravation, then means the mental disease is of corporeal origin. In aphorism 225, Hahnemann says about the fourth classification of mental disease, that is psychosomatic mental disease. That is, mental disease originated and kept up by emotional causes. That is long-term anxiety, worry, vexation, and frequent occurrence of great fear and fright that cause some inroads into the corporeal or physical health of the patient. So the body slightly become indisposed to, and that gets and the corporeal health also gets destroyed due to the prolonged emotional problems. In aphorism 226, treatment of psychosomatic disease, Hahnemann says about the treatment of psychosomatic disease. That is, if a mental disease is of recent origin, that is, before the mental disease had made any inroads into the corporeal or physical health of the patient, then we have to consider psychical remedies. There is psychical remedies, that is display of confidence, sensible advice, friendly exhortation, and well discussed deception. So plus diet and regimen. So if the mental disease of a recent origin, a purely psychosomatic mental disease, before it had made any further disorder in the physical health, a mere counseling plus diet and regimen of the patient can cure the condition. In aphorism 227, Hahnemann says about mental disease from psychological origin its fundamental cause is sora. So sora, if sora is not fully developed here, it's not fully developed in this condition, and we have to consider anti-soric remedy to prevent its recurrence. In aphorism 228, treatment of mental disease from corporeal maladies. So in aphorism 228, Hahnemann says about the treatment of mental disease from corporeal maladies. So in this condition, we have to consider what is called as auxiliary mental regimen. That consists of three factors. First is antisoric remedies, second is well-regulated mode of life, and three is psychical behavior to the patient. So the physician and the bystanders and the keepers should behave in a peculiar way in such condition. That is, the physician should avoid any kind of reproach, should not be handle the patient in a rude way, and the physician and the keepers and the bystanders should arrange everything in the clinic and the house so that the patient there is no circumstances is created so as to create a violence in the surrounding, and physicians should avoid any kind of corporeal punishment and tortures. This is what Samuel Hahnemann has written in the Organon of Medicine in the treatment of mental disease. And there is no compulsion about the taking of medicine. And if the patient does not like to take medicine, does not like to take medicine, then don't force him, don't compel him. Just mix the medicine with his drink and with water and give to the patient. But any type of compulsion, reproach, or punishment should be avoided in the case of mental disease, and the physician should behave in a peculiar manner, in a unique manner to every type of mental disease. For example, If the patient is very furious mania, then the physician should be calm, cool, and firm. And as Hahnemann says that if the mental patient is have doubtful lamentation, then the physician should have a commiseration in looks and gestures. At the same time, if the mental patient is having a senseless chattering, is doing senseless chattering, then the physician must be in a silence but not inattentive. At the same time, if the mental patient is is doing a distressing, disgusting, unavoidable conduct, then the physician should do a total inattention. So the physician should behave in a peculiar, intelligent manner in every kind of mental disease, towards every kind of mental patient in a very intelligent manner. In aphorism 229, Hahnemann says that any kind of contradiction, any kind of eager explanation and rude correction should be avoided, and as that all causes aggravation of the complaint of the mental patient. And the physician and the keeper must pretend to behave to them, to believe them to be a sound nature. The physician should act like as if the mental patient is having a person of a sound reason, as if the mental patient is a normal person. So any kind of amusement, distraction, any eager explanation and conversation should be avoided to a mental patient. In aphorism 230, Samuel Hahnemann says that consider mental and emotional state as the principal symptom in the totality construction of a mental disease. And Hahnemann says that the superiority of the homeopathic system as the treatment of is in the treatment of long-standing mental disease and emotional disease originating from corporeal factor. So the treatment of a long-standing mental disease, its complete cure is the reason, or is the reason behind the superiority of the homeopathic system. So that's all about the mental disease according to homeopathic concept. Thanks for watching. Thank you.